All right, ladies and gentlemen, good evening and welcome to another episode of Telehealth Tuesday. This is your go to podcast for insights on modern healthcare and wellness solutions. I'm Dr. Michael Bookhardt, your host, and today we have a very special episode lined up just for you. But before I tell you all about my next special guest, I want to let you know, take a moment to let you know that Telehealth Tuesday can be viewed on uh, multiple platforms such as our YouTube channel, Doctor B T.V, which is the word doctor, spelled out Doctor, the letter B is in boy, TV, and also our clinic information. And also you can catch us on Instagram, Heart of Music, and also our Facebook pages. So please make sure to follow, like, share, tag, and most importantly, subscribe to help support this amazing program. Now, I want to tell you all about my fraternity brother, the incomparable Dr. Terrance Ware. But look, sometimes we're going to we read the guest bio, but I think because this is my brother, my friend, and somebody who I respect most, I want him. I think it's going to be made better if he tells you himself. If you hear it first from him, he's going to tell you about where he's from, what he's doing, where he trained, all that good stuff. So if you don't know him already, you're going to know him tonight. So, ladies and gentlemen, I do see Dr. Terrance Ware in the background. We're going to have him to unmute, and we're going to he's in the backstage. He is ready to go. And let's count down 5, 4, 3, 2, 1. Ladies and gentlemen, hear ye him, Dr. Terrance Ware, DDS. Give it to
What's up? What's up? What's up, people? How y'all doing?
All right, all right. How are you feeling this evening?
Man, well, how are you?
Oh yeah, great, man. It's another wonderful, fantastic Telehealth Tuesday.
That's right. That's right.
Yeah, man. So look, let's get right into it. Why don't you tell our viewers, listeners, and friends all about who Terrance Ware is? You know where you're from, where you trained. We already know what fraternity you pledged, the number one
Yes, sir.
fraternity, yeah, the fraternity in the world, Alpha Phi Alpha. But tell us all about you and where your clinics are located and what you're doing.
All right. First of all, thanks a lot for having me on, brother Bookhardt. Of course,
Absolutely.
my name is Dr. Terrance Ware. I was born and raised in Indianola, Mississippi, in the heart of the Mississippi Delta. I'm the fifth child of John and Sarah Ware. My father was a minister, is still a minister in Indianola. My mom taught school for 27 years in Indianola, so we know pretty much everybody there. I have brothers three brothers, one sister. Um, I was went to Gentry High School. Of course, you know the public schools in Indianola. Went to Gentry High School. Graduated from Mississippi School of Math and Science, class of 1998. Then attended Tougaloo College, the great Tougaloo College. Chemistry major there. Graduated there in 2002 and went to University of Tennessee, Memphis. My sister is also a dentist, Dr. Latanya Ware in Grenada. We were at the dental school at the same time. We went to Mississippi School of Math and Science at the same time. Ended up graduating there, and then I practiced in Memphis for 2 years, which I really enjoyed because I'm a music head, much like you, Dr. Bookhardt. So I like to go listen to live music. So I enjoyed being worked in private practice there. Some of you may know the doctors I work with, Dr. Miller, Roderick Miller, and Dr. Payne, Derek Payne. Um, Great mentors and great friends that taught me a lot. Almost like being in the GPR. So left there and moved back to Mississippi. My wife attended MC College, School of Law, and so we were able to move back to Jackson so she could attend law school. My wife was on a couple weeks ago, and so that's how I ended back up in Mississippi. I worked with my sister a couple of years at her practice, and then we opened a practice in Crystal Springs. First practice I ever opened. Then we opened one in Jackson, where we kind of merged those practices together. And then a few years ago, we opened a practice up in Flowood, Mississippi. So business has been good. We've been doing well, trying to spread great dental health to our communities.
So important.
Yep.
So important. Awesome. And one thing I want to know, I don't think we've ever talked about it. Where did you get your passion from for, to first become a dentist?
So, it's a funny story. So my dad made dentures. He's a lab tech. Did lab tech work for like 50 years, and so he owned a dental lab, which is actually right beside our house, my
Mhm.
entire life. So I kind of just saw the need for dental health, dental education. So made dentures impartial. So I saw how much what he did meant to the patients that he had. Um, and I just really kind of loved what he did. And I was kind of on the fence on whether I was going to go to law school, to medical school, or to dental school. And a couple of things happened, so I just decided. So I'll tell you the real story. So my brother is a high functioning person. I have a brother named Marcus, where is a high functioning person.
Oh, yeah.
He was number one in his class, Tougaloo, at number one in his class at Gentry. Also went to Harvard Medical School. He's a Harvard trained neurosurgeon.
Oh,
And
yeah.
so when I was young, he's 9 years older than I am. When I was young, he used to talk on the phone. He was complaining about residency. And I was like, if he's complaining about residency, I don't want to
Oh,
go.
yeah.
So they took me out of the whole medical field, and so I decided against law and just decided to go with dentistry, just because I had been around it a while, and we my just because my dad was around a lot of dentists, and we just spent a lot of time around dentists, so I thought it was a good way to make a living and make a difference.
Absolutely. That's awesome, man. I appreciate that. Well, let's get right into it. One of the questions we had, first question, why is dental health so important, and how does that affect the rest of our body overall?
That's a great question. So a lot of people don't see their mouth as a part of their body, right?
Mm,
So people think that teeth are something that you can take in and out, just like it's not a part of your body, like a body part. So you wouldn't want to just remove your fingers or remove your nose. So your teeth and your mouth is really important. It's the gateway into your entire body. It's very important to maintain good oral health because those teeth that are in your gums communicate directly into your body, communicate directly into your arteries and bloodstream, and so you have so many blood vessels in your body. If you have bacteria there, you can cause all type of inflammation that causes problem in other parts of your body. So um, periodontal disease, which is gum disease, has been linked to all different types of inflammatory responses in your body, such as diabetes, such as hypertension, um, so many different other diseases that come from that. So it's very important to kind of watch what's going on in your mouth. And the problem with most people in the mouth, they don't really go. Most people don't deal with their teeth until they start hurting. And
mhm. Oh,
so once they
yeah.
start hurting, you got, especially in our communities, people don't go until something is hurting. And dental disease are really silent killers because you don't have pain until it's too late. Um, so it's very, very important to kind of have a dentist look at you, kind of see what's going on in your body to make sure that you're not contributing to your overall health in a bad way. When we're talking about like diabetes, hypertension, all that kind of stuff is directly linked to your mouth, especially also with pregnancy. Pregnant women can have preeclampsia. You can have low birth rate in your I'm sorry, low birth weight in your child. All different types of stuff that can happen just because of the inflammation in your mouth.
Mm. I'm so glad that you illustrated those things, because I think a lot of people don't think of teeth, like you're saying. They don't think of it like a true part of the body, like a gateway, as you were
Yeah.
saying. And a lot of people, I feel like, you can correct me if I'm wrong, but I feel like a lot of people, it's almost like they put their mouth and oral health as like a last priority. Like, I'm gonna, because they're reluctant to come to us, as well. They don't want to come to the doctor. But if they have diabetes and things like you just mentioned, they'll come to us. But it's
Right.
kind of like, man, you get you patients will come in, and I'll say, all right, so, open your mouth and say and I'm shining the light and use a tongue depressor, and I'm seeing all the side the side teeth and back molars are gone. And I said, when's the last time you went to the dentist? Oh man, I don't go to the dentist. What you know?
Right.
What's up with that?
Well, most people associate dentists with pain. So
Yeah.
I mean,
Oh yeah.
I cannot lie to you. I tell my patients all the time. I used to have to get a whooping to go to the dentist. I hated going to the dentist when I was a kid. I hated it. Uh, and so I just knew I could do better than what I was going through, and so I just knew I can do much better. So um, the reason why a lot of people our age just wait until teeth are getting ready to fall out to them because the pain associated, the money associated with it, and then the cultural stuff, like your grandmothers and your mother telling you, oh, you don't need that too, just pull it out. So I mean, that's really the main reasons right there. If you can kind of, as a dentist, so I try to alleviate situations where people are in pain, where they don't be so nervous to come in, so they can go ahead and come in and we can check out things. So that's one of the main things we try to do, to try to make sure people are not afraid to come and see us, and we kind of make it uh, as comfortable as possible. We like to listen to the music and relax and talk to the patients and show them on the X-rays what's going on, so they can won't be so
Mhm.
nervous and hesitant about getting things done when they actually need them.
Absolutely. We got a comment from Mr. Dexter Mayberry. Uh, a good brother says, "Amen. Chronic illness and healing starts in our that's or you meant by our mouth in our mouth first." So
Mhm.
yeah, absolutely. So yeah, I'm glad you pointed that out because my second question was going to be, can poor oral hygiene really lead to serious health problems? And I know you touched on it just briefly when you talked about diabetes and uh, infections going into the bloodstream, and basically can lead to sepsis. And that's one of the things, man. Before I went to med school, even me, because I was ignorant to the fact, like how important our teeth are. And when I got into med school and saw that if you had an infection, periodontal disease, and all this stuff can go, like you were saying, through our bloodstream, it can seed an infection onto our heart valves, and cause endocarditis, man.
All right.
So yeah. So yeah, I never knew that, until I got into this field myself. So I don't know if you want to, do you have any maybe personal or patient related examples of this, like some, I guess, unfortunate, patient who got to you really late in the game and they ended up with certain infections or anything, and just, maybe to share with our viewers, our audience.
Probably the worst thing I've ever seen in a patient's mouth was kind of one of those things where a patient waited too long. So this
Mm,
patient had um, had squamous cell carcinoma, which is a cancer in her mouth. She thought it was an abscess and had been taking kind of over the counter stuff. Um, uh, Mouthwashes, and she was using like warm salt water, Dr. Tishner's and stuff like this.
mm-hmm.
And if you guys probably never smelled it, it kind of smells like rotting tissue. So
Mm.
she had kind of waited so long till
Lord
she ended
mercy.
up having to lose part of her jaw. Um, and so stuff like that happens all the time. And so I have patients that come in that may have been dipping snuff or chewing tobacco, as they call them. That's a cancerous problem. People can cause, they can cause cancer by using that. Of course, I see people all the time that come in that haven't been to a dentist in a while. And the thing about periodontal disease, which is different from cavities, people tend to have a problem with one or two teeth that can start feeling it. With gum disease, you don't really feel it until a lot of times it's too far gone. And
Mhm.
if I can kind of explain it a little bit better, periodontal disease is basically the disease of the periodontium, which is the gums and bone. Okay, so as let's just say if this is your tooth right here, this is the top of the tooth that you see. This is the bone that's right here. So the bone is usually here. Okay, as that bacteria and plaque calculus gets up under the gums, the gum tissue does not like that. Okay, So the inflammatory response that's there is going to be bleeding, swelling, all that kind of stuff. So those are the first signs. But over time, that bone and that tissue moves away from that bacteria, right?
Mm,
Keeps moving away from that bacteria, which makes the tooth longer, right? And the bone shorter, right? So the problem is if you don't see anybody for a while, these teeth are right beside each other, right? So you don't usually lose one tooth. By the
mm.
time there's a problem, you have 4 and 5 and 6 teeth that you're gonna have a
Mercy.
problem with. And that bone really never comes back. A lot of times you can stop the periodontal disease, but as far as getting that bone back, is generally a major problem. So that's the biggest problem where I see when people don't come in and get their teeth clean. A lot of time when people pain is the impetus usually to get people to come in. So I
Wow.
always say that pain is bad, but it's good because without that pain, people would just sit and just wait
Yeah.
until the whole thing's until they die.
Wow.
We just
Oh,
wouldn't do anything until something hurts. So
mercy.
when most of the time if it's a pain, it can be 1 or 2 teeth that hurt, but when it's gum disease, it's going to be several teeth that go away.
Lord have mercy. Well, I appreciate you sharing that. That's an awful story, but I think
Yeah,
that's something we need to get our people to wake up. And I wanted to share. I put this up there if you can see it, Doc, from Miss Tiffany Giles. This
mhm.
is Tiffany Giles with Wound Rep. With You're going to help me out with that, Tiffany, with the name of with the good RX Wound Company. She's one of the reps there. Does a phenomenal job. Thank you for joining us. But she had a question. What are your thoughts on fluoride in toothpaste?
That's an excellent question. So I get that all the time from my patients. So I have what my personal answer is, and then I have my his answer. So I have two hats that I wear here. Okay.
All right.
Um, so I have not personally seen any any studies that show that the
Hmm.
amount of fluoride that you use from brushing your teeth can cause that much damage to your body. That because there's always cost benefit analysis there. Okay,
Hmm.
so most of the fluoride that people get in their bodies that would be enough to cause a problem would come from fluoridated waters. So that's going to be in your waters, your tap waters. The amount of fluoride, because you don't supposed to be swallowing the fluoride, so it shouldn't be that big of a deal. Um, Fluoride is really good to keep teeth strong. So the chemistry basically, those teeth are made from hydroxyapatite crystals, which makes the enamel hard. As that enamel gets soft from acids that come from sugars that are digested, um, you replace that with fluoroapatites, which is the fluoride makes it very, very, very hard. So that keeps people's teeth from kind of getting soft and having issues over time. Now, as new information comes out, in medicine and in science, as we learn new things, we do new things. So if I have not seen it where it's a major problem, and so until I see the cost benefit analysis move, then I'll still recommend my patients use fluoride toothpaste. Now there are toothpaste that really work that are not fluoride toothpaste, but that's really contingent on the patient's on what they're doing outside of brushing. So you're gonna have to make sure that you're not taking sugars in. You're gonna have to make sure that you're being on top of your flossing and brushing and all that kind of stuff. So you don't have to replace good tooth structure with fluoroappetite structure. If that makes sense. Do that make sense?
Awesome.
Okay.
All right, Tiffany. You all right? You heard it first, right here. We'll take a quick pause for the cause to, you know, you know, Terrance, we don't we're on our way to becoming syndicate, but right now, so I'm gonna say commercial break, but I am the commercial. She
Okay.
said yeah, yeah. She said yes. Thank you very much,
Okay.
Tiffany. A big shout out to our RX Wound slash Senior Home Services. There we go. Big shout out to the company. Thank you for joining us. So, ladies and gentlemen, quick pause for the cause. If you don't know who we are and what we are, then you're seeing it now. If this is your first time, we thank you for joining us. This is Telehealth Tuesday. I'm your host, Dr. Michael Bookhardt. We're joined by none other than my frat brother, my friend, the incomparable Dr. Terrance Ware from Indianola, Mississippi, practicing here in Jackson, Mississippi, and a second office in Flowood. And we are learning all about oral health. We've had some amazing questions. We've had Tiffany just ask a question about fluoride and should we be using fluoride in toothpaste. We even had, we touched on a basic anatomy lesson that Dr. Ware showed us where the tooth is and the bone structure. And so listen, if you missed it, you can always go back to the archive and watch all 49 episodes that we've been doing for almost a year now. But again, we're blessed to have him here. And so just wanted you all to know that this is Telehealth Tuesday and we can be viewed every Tuesday, okay, 7 o'clock p.m. Every Tuesday, God willing, we are here. And we've been starting on time. All right. So thank y'all for joining us. All right. So right back into it. Dexter's saying he's making a couple of comments. Poor hygiene can lead to skin infections, GI, urinary tract infections, and eye infections. And he's also saying that pain is a way that your body is warning you that something deeper is happening inside. So absolutely, Dexter, and that's what Dr. Ware touched on a few minutes ago. That he was saying that pain is good and bad. It's bad for bad for the patient, bad for you, but it's also good that you can come and see him because had it not been for that pain, Dexter, that you're talking about, they probably would have never come and seen him. And even I'm guilty of it. I talked with him. I said, man, this has been bothering me for weeks and months. He said, man, you crazy, man. You come on, you know better than that. So just y'all pray for me that I don't end up with a root canal. But
Root canal is not the worst thing in the world, sir.
it's not okay. But you now you know what, when you okay, I see Charmin. What's going Hey, Charmin, Dr. Charmin Robinson here. Shout out to you. You can put the name of your company up there, Charmin, and we want to give you a big ups and put your company on there. We'll highlight you tonight. But man, I wanted to ask you. So when it comes to root canal, I know there have been a lot of advances in dentistry. So, but is a root canal still performed the same way? And is it, how much pain does the person have to endure? Like, and just basically educating us about what is a root canal and why do you have to have one?
Okay, that's an excellent question. So, a root canal is actually called root canal therapy, right? So every tooth has several layers in it. The first layer that you see is the enamel, right? That's the most dense layer and the layer that's most shiny and looks the best. All right. So the layer below that is called the dentin. It's a little bit more porous, and so that's the layer of the tooth that when it starts getting cavities, it goes a little bit quicker because it's less. Then you have under that what's called the pulp. The pulp is what the nerve is. Okay, so you got the nerve supply and you have the blood supply there. And so when the teeth is remineralizing and recalcifying itself, all the blood supply comes through that area. Okay, but because it's very open in the middle, right? So when bacteria goes from the first layer of the tooth to the enamel to the second layer, the dentin, and into the pulp, once it gets to the pulp does not know what to do. It's so much room in there that those bacteria multiply very quickly and make a home there in the nerve. That's when you start feeling pain. At that point, the nerve dies. That's when you stop feeling pain because the nerve is dead at that point. Okay.
Mm,
Now, at that point, once it stopped hurting, you know how people say, "Man, this tooth was hurting me," and it just stopped hurting. Okay, and they
yeah.
think it's all good. No, it's not all good. So the next thing that happens is the abscess. Okay, the abscess is your body trying to save your life. So what your body does is kind of sends in all those white blood cells and rushes all that kind of stuff in there to try to encapsulate the bacteria and everything that's dead inside that tooth and kind of get out of the mouth get out of the body some type of way. And so that's where the swelling comes from. The body is looking for a way to get it away from everything on the inside. It's pushing it out. Okay. So a root canal is basically when we go inside that tooth, we clean out the nerve, out the nerve supply inside the pulp, inside the canal of the tooth, clean all that out, sterilize that area, fill it or seal it in really well, and then close it up. Once we close it up, we put a crown or a cap on top of it to keep that tooth from breaking over time. And so the techniques have gotten a lot better over time. Um, what generally the most of the problems came when people trying to do root canals with infected tooth. If a tooth is infected, most of the time it's very very difficult to anesthetize that tooth. So it's gonna be hard to numb it, and you're gonna still feel it no matter what. If you don't have that infection out. So what I generally do and what most doctors do now is put you on an antibiotic and get that infection down so they can actually go in there. And it's not generally bad at all. You go in there, take the nerve out, clean that area out, fill it up, seal everything off, and put a cap on top of it. And they last pretty well. They do pretty well.
How long would you say that procedure takes? You know.
It just depends. So each tooth has a different anatomy. I'm sure you probably know that. But so the front teeth usually have what they call one canal. The back teeth sometimes have three or four canals. The side teeth usually have one, two, or three canals. So it just kind of really depends on which teeth that you're working on. The front teeth take about 40 minutes to do if you're just sitting there to do it. And then the back teeth generally take a little bit longer, probably about an hour or hour and 15 minutes or so to do. If you just sitting there, some people can do it faster, some people can do it slow. It just kind of really depends on the anatomy of the tooth and what all you got to do when you get in there.
Awesome. Okay, man, we've got an amazing barrage of questions, man. So I call this my rapid fire. Whenever our audience kind of and look, we want y'all to keep them coming. It's about 6 or 7 of them, Doc. So I'm
Yes,
just
sir.
gonna
Yeah.
put mine aside. Y'all keep them coming. All right. So I'm gonna have to scroll up to find the first one. We got so many, but
We got
y'all
some
keep
of
them
our
coming.
people here, some of our people
Yeah.
on here.
There we go. Okay, the first one, let's go to Dr. Sharmon Robinson, owner
Mhm.
of In Touch Physical Therapy. Big shout out to you and thank you for everything that you're doing in the community and also for what you've done for my mother, Dr. Robinson. So she says, Dr. Ware, can you ever be too old to get braces to correct a lifelong gap?
Too old is a relative question, right? So what is too old? So I would say no. I would say no, because if you still have healthy teeth and you have a gap that you want to put in there, generally the problem with braces, if there is a contraindication to braces, it's gonna be like gum disease or something like that. But if somebody has healthy teeth and they just want to close their gap, they can use braces, wire braces, or you can do Invisalign, which is a clear alternative to braces that only I will know and you will know, or whoever your dentist is know that you're using. It's like a mouthpiece that you wear, almost like a night guard or something that you wear in Invisalign, where you wear you wear that night guard, or they call them aligners. So you'll wear the aligners you'll wear them about 2 weeks to 3 weeks, and it moves those teeth where you need to be incrementally. That works really well if you just want to close a gap. But wire braces work really well for those people that are not going to be compliant to wearing the braces. But the short answer is no, you're not too old to do it if that's what you want to do.
Awesome. Awesome. All right. Well, we're going to keep rolling. Let's see. Keisha Baker. All right. Good evening. Thank you for joining us. She says, "What happens now?" She says, "What happens when you don't have it?" I think give us a little follow up with that, Keisha, because I know we've talked about several things, so I want to make sure we don't miss what you're asking. Okay. Let me, and then we're gonna go with Yasmin Ware is there.
Oh,
That last
Lord.
name sounds familiar.
That's my baby, y'all. That is my baby girl. I love her.
Yeah.
She's
All
awesome.
right. Yeah, what's going on, Yasmin? Where? Yakisha, we'll come back to you real quick because I'm just going in order. So Yasmin says, how many cavities should you have before visiting the dentist?
Well, generally, most people don't know they have a cavity until they visit the dentist. So I would say just start early and let the dentist tell you, because once you know you got a cavity, sometimes you're gonna have, most time you're gonna have several of them. So I say as soon as possible, it's possible to go ahead and start seeing the dentist so they can kind of let you know that you have a cavity.
Awesome. Awesome. Great question, Yasmin Ware.
Yeah, she's super smart. She's a great kid. I just love her. So proud of
Yeah.
her. I'm so proud of my son too, Jacob, in case he's around.
Awesome. 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 Yakisha says, okay, and what research do you have? What research do you have with it connected to breast cancer? I was once told that it can cause. Okay, you're saying you were once told that a root canal has a connection to breast cancer.
Well, I
Uh,
have not seen that research, and I'd love to send it to see it. So if you have that, you can send it to Dr. Bookhardt, or you can send it to me at twaredds@gmail.com. I've heard people talk about those things, but never anyone in the medical field or anyone that actually does any type of research. So I haven't not seen that, because two things can happen at the same time, but not really be correlated to each other. So I just haven't seen it, and if it's something that's real, I would love to see it.
yeah, absolutely. Yeah, we'd love to hear from you on that. Yeah, just send that information to us, and we'll definitely address that. All right, Dr. Justin Turner, man, good to see you again. He says
That's
that's
my
my
brother.
dentist.
That's my
Yeah,
brother, Dr. Turner. I'm so proud of Dr. Turner. He's always moving and shaking. He's done a great job with the state of Mississippi, and he's now at UMC. He's a good brother, man. We just love Dr. Turner, man. Good to see you, brother.
absolutely, absolutely. I definitely second that. He's saying educate the people. This is the people's dentist. Yeah, absolutely. Appreciate. Thank you for joining us. Dexter saying another question: which would you say is the safest and best for a person who has lost their teeth, dentures or implants?
Man, that is a
That's
fantastic question.
a and
That's a
yeah,
fantastic question.
it truly is.
So that's truly dependent on a lot of factors. Okay, so some people lose their teeth because of cavities, rampant cavities and stuff like that. Some people use their teeth because of periodontal disease, which is the loss of bone structure. Um, so the long and short of it, dentures have worked well over the years. A lot of people have used them to help them, both with their smile and their ability to eat. The implants is a more new thing that we have now, and the implants work really well, contingent on a few factors. Um, if somebody is going to have implants, they need to have enough bone to support the implants. Um, so if you got enough bone and you can get a good restoration in there, the implants work tons better just because of the patient's ability to chew better. Just because those implants kind of stay in place better and they work. They're probably the closest thing that we have to natural teeth, contingent on if you have enough bone to use them, and contingent on other factors like your health and stuff like that. Smokers is not a good option. Implants are not a good options for smokers. Um, some people say people that grind it's not good for, but I've seen people with implants that grind. Sometimes you break the restoration, but I'd rather you break the restoration than not be able to eat. Um, so the long and short, implants are better if you have the bone structure and you're healthy enough to get those.
Awesome, awesome. I want to let's break. I'm going back and forth between our main medium here with our Facebook viewers and our YouTube viewers, and also Instagram is always separate. So in Instagram land, Rebecca Banks from my hometown of Orlando, Florida, shout out. She's saying, is it beneficial to use activated charcoal toothpaste?
That's a great question. So there is a long and short answer to all these questions.
Yeah.
All right. So the short answer is that the activated charcoal will sometimes remove stains. So like you have heavy staining on your teeth, that charcoal toothpaste works pretty well for getting some of those stains off. The problem with the charcoal is that because it's because of the hardness of the particles in that charcoal, it can kind of scratch your teeth and cause more porosities in your teeth, which cause it to stain more subsequently. So if
Mm,
you're using it short term, and you're not going crazy with it, it does pretty well short term. But what you want to do is make sure those teeth are polished and cleaned up really well so they won't secondarily pick up more stains
mm.
after.
Awesome. Okay. Excellent.
It makes
All
sense?
right. It makes sense, Rebecca. All right. Our brother, Driscoll Duvall,
Brother
chapter president.
Driscoll,
Yeah. He
chapter
said,
prayers.
that's right, chapter president. He says, I love it. I love it, bros. He said, can you talk about why it's so important to keep your natural teeth as long as possible and how losing teeth can actually change the shape of your face over time? Wow.
Man, that's a
Wow.
fantastic question. He seemed like he already knew what's going on here.
Right.
So keeping your teeth is very, very, very important. Just because I think God is the best architect, and I don't think that we can make anything better than God made. Right? So,
Amen.
so keeping your own teeth actually keep your bone in place. Once those teeth are removed, your bone goes away. So, just like you said, Brother Driscoll, once those teeth go away, sometimes, most of the times, the bone goes away, and so over time, your bone structure will start to sink in a little bit. um, and there are studies that show that people that have 10 or less teeth of their own teeth remaining are 66% have a 66% higher chance of having cardiovascular disease. So it's really,
Mm,
really important to try to keep your own teeth if you can.
mm. So I hope translation for all the folks out there, you need to keep your teeth because
The
if you
teeth.
keep going to these dentists and who are just my mom, my mom used to say, you know, I thought about this and she's definitely listening. She used to say, and I know you're going to say this is so crazy, but back in the 60s and 70s, she said she did not believe in going to black dentists because she said back then, I guess she said they didn't get enough training and all they would do is they were just some certified teeth pullers. I don't know if
Certified
you
teeth
want
pullers.
I don't know if you want to comment on why that if that was
Yeah,
ever
I would
true
love I would love to comment on that. So 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 a lot of times in our communities, like I said, a lot of people didn't go to the dentist until they were in pain, and so you had a couple options at that point. Either pull most of the time when the tooth is hurting you, you can either do a root canal on that tooth or take it out.
or.
So that's part of it. And a lot of us didn't go at a point where the prevention was an option. So and then if you look back in history, to black people were able to go to dental schools and medical schools in the United States. Um, a lot of times we had to be the best of the best and the cream of the crop. So
Mhm.
if a black person went through dental school and medical school during that time, they're going to be very, very, very smart. So we're not worried about that being true.
Yeah, I hope Lily James, I'm calling you out. I hope that you're listening across the airwaves. That is exactly what I said to her over the years. I said, now especially back then in those days, and maybe some of them were some, teeth pullers, as you say, but of course it was just as hard, or like you said, even harder to get in, and then there were so many other barriers. So you had to know what you were doing. So
Yes.
uh, yeah. All right, let's good. We're gonna man, they rolling in, bro. I'm
Yeah,
telling you.
we got some good questions.
Yeah, great question. So Dr. Turner is he says, and I know we touched on a little bit of this, his question, the connection. Is there a connection between oral health and heart health, which we know is the number one cause of death in Mississippi? And he says also, it appears that people would see their dentist more often if they knew that and wanted to live.
That is definitely true.
Mhm.
We talked about it earlier, Doc, right before you got on, how periodontal disease is directly linked to cardiovascular disease, how the inflammatory responses of your body, and the plaque and calculus that's under your gums, gets into the bloodstream and go directly into other parts of your body. So you can get plaque formation inside of your blood vessels, which can cause strokes, all the heart attacks, um, any type of this any type of bacteria that gets into your bloodstream can cause so many issues. And then people have bleeding gums. If you look at it, so the gum tissue is epithelial tissue. For those in the medical field, the epithelial tissue is the same as this tissue, right? Right. So if you rub this arm right here, if I just rub this and it started bleeding, we'll know that's a major problem, right? But the
Major.
same thing, if people take floss and rub it in between their teeth and they start flossing, I mean, it starts bleeding, then we don't realize it's a problem. So that's a major problem because you can have a direct opening, a direct ulcer that goes right in your blood vessels with bacteria that goes right into your body. So that's really important to see your dentist to get rid of all this gum disease. It's going to be linked directly to heart disease, hypertension, and diabetes.
Absolutely.
Pneumonia too. I mean, I've read studies
Yeah.
that show that it's connected to pneumonia and different things like that as well.
Yeah. Yep. Absolutely. It definitely is. Uh, all right. Ms. Baker says, is gum disease more prominent with age or the health of the individual?
It's gonna be probably it's gonna be both because most of the time it's based on your gum disease is gonna be based on your oral health. Now there is a hereditary component with gum disease, but most of the time it's going to be based on your oral health, whether you're brushing it, because this is simple things that you need to do to get rid of the gum disease. It's going to be brushing, flossing, rinsing, right? So a kind of weird thing is that people that usually have gum disease generally don't have cavities, right? It's weird because
Mhm.
those two type of bacteria don't like each other, right? So you got the aerobic bacteria anaerobic. So the anaerobic bacteria is the one that causes the gum disease, and they are more virulent than the other ones. So they usually kill those other bacteria. So
Mm.
a lot of times, if you see somebody and their parents don't have any teeth, then 9 times out of 10 they're gonna have gum disease in their family. So and that's just based on the type of bacteria that live in their mouth. So
Mm.
we had to take that out and stay on. You really got to stay on top of gum disease because you can see somebody at one point. I know this is a long answer, but you can see somebody at one point and they have what's like small pockets. They call them pockets. Let's say from the top of your gum to the bottom of your gum should be 1 to 3 millimeters, right? If when it starts from the top of your gums to the bottom of your gums start to be more than 3 millimeters, like 4, 5, 6, 7, 8 millimeters, they call it a pocket, just like a pocket in just like a pants pocket. They call it that because you can't get in there to clean it out real good, and it's a place where you can't get that bacteria out of there, right? And so that bacteria goes down in there, and you just can't get it out, and so that's what causes the disease to get worse and worse over time.
Awesome. Okay. Excellent. Excellent. Rebecca has another follow-up question, and then I want to, man, Doc, I want to talk about these. I want to talk about these large veneers. But before we go to that, let me, uh, Frank Terry, man, on Instagram land, our frat brother and my line brother Terry is on there, man. He gives big shout out to us, man.
My brother.
Yeah. She's Rebecca says, "Is there a and then Rebecca, I'm gonna ask your question, and once he's done, we're gonna jump real quick on veneers, and then we're gonna get back to the Facebook question." Uh,
Okay.
she says, "Is there a connection between oral health and sinus infections?"
Yes, and yes, I would say yes. Well, yes and no. Because your sinuses is your maxillary sinus is right by your upper teeth. And so if somebody has a lot of infection around their gum tissue, then there's a chance that they can also cause sinusitis. Um, and sometimes when somebody has sinusitis, that mirrors a toothache. So when somebody has a problem, and if it's on both sides, I generally say, okay, this is sinus. If it's on one side, it's going to either probably be sinus or it could be linked to a abscess or something like that, or gum disease in the area of a tooth.
Mm, gotcha, gotcha. Um, quick. So mine is just a little quick anecdotal. What man? What is going on with all these folks on Instagram and celebrities with these huge chiclet horse veneer teeth? Why are dentists even putting these teeth in people, man? Is this some type of Hollywood fad, or do the patients actually request for the teeth to look this way?
Generally, the patients request for the teeth to look this way. So we do veneers also. I try not. I do
Okay.
them, but I try to make them look as natural as possible. So usually, I try to get my patients to do maybe like a whitening, straighten their teeth like that, just because doing the veneers can be a irreversible thing sometimes when you start cutting on the teeth. Now, veneers are not a bad thing if they're done correctly. They can correct a lot of different things. They can correct crossbite. It can correct the shape and shade of your teeth, and make people a lot happier with their smile. Can
Mhm.
increase somebody's their self-esteem, X, Y, and Z. So they're not a bad thing. I think they're kind of overused now. Um, but I'm not completely against them. But it's just you just got to do all things in moderation. All things in moderation.
I just, oh, wait a minute. I just had to get that one in, man. I had to get that one in. Um,
Veneers are not bad though if they're done correctly.
gotcha. Okay. All right. Now back to our our Facebook and YouTube viewers. Let's see. Implant. Ellen McLaurin says, or asks, she's asking, are children to start seeing the dentist around the age of 2, and then with every 6 month cleanings? If Parliament, let's put that on the so he can see it. Everybody, okay. Our children to start seeing the dentist around the age of 2, and can say Q 6 months. So basically, meaning every 6 months having a cleaning, if possible. And then she says an annual with adults, if possible. What insurance do you see that often will pay at 80%? So we've got I think that's a two for or a three for there, Doc. So I put it up on the screen for you.
Gotcha. So, most pediatric dentists say that, and I do too. I think that that patients, kids should start seeing the dentist as soon as they start getting teeth, just to kind of start getting them used to going. And then I like to see them every 6 months, but I usually like to send the little kids to pediatric dentists just because they're trained to do that a little bit more than. I mean, we know how to see kids. It's just that they see them more often and
Hmm.
they treat more often. So, like if we have patients that have kids, they bring them to me, but like I refer to great pediatric dentists here in the city that do really, really good job here. So Dr. LaMonica Taylor, I usually send to or Dr. Rose. They do a really good job. I send to them, and they take care of little kids. But as soon as they're about one or so, we go ahead and send them and let them start, seeing the pediatric dentist.
Okay, awesome. And then she says, if possible, annual. Oh, she says, what insurance do you see that will often pay at 80% or more?
Most of them will pay 80% or more on cleanings and stuff like that.
Okay, that's excellent. Great questions, Ellen. All right, back to Miss Tiffany Giles. What are your thoughts on oil pulling and its ability to fight bacteria in the mouth? Oil pull, is that a thing? Oil pulling?
Oil pulling is a thing. So
That's a thing.
it's basically coconut oil that people use, and different types of oils like that. It's kind of a Eastern medicine type deal, or
Mm-hmm.
older. older people type of deal. But coconut oil works really well. Most of it is basically trying to get rid of the acids in your mouth. So, like I don't know if we talked about this earlier, but most of the time the cavities are caused by the acidity in your mouth. So the sugars that you eat, the bacteria in your mouth will eat those sugars and digest those sugars into acids, and then the acids erode the tooth to make the teeth soft enough to make holes in the teeth, which are called cavities. And then that process exacerbates each other. The coconut oils goes in there and kind of naturalizes, denature those bacteria, and gets rid of the acidity, and therefore helps get rid of the infection.
Awesome. Great answer. Great question. Even better answers. All right. Let's
These some
see.
long answers, man. I'm giving some longest answers on earth.
No, it's all good, man.
I'm
We've
sorry.
got
Yes,
we
yes is the answer.
yeah, yes, right. Let's see. Look, I'm gonna all right. I see a couple of questions. I just want to hop to one of your colleagues who I featured on here last year. We have Dr. Deidre Snell is in the
That's my Sarah. What's up,
yeah,
Sarah? And
that's it.
my neighbor. Our offices are right beside each other in Jackson.
Oh,
So
that's right. That's right.
yeah,
Yeah.
yeah,
I mean,
she's been a great neighbor to us.
excellent. Well, Dr.
Good
Snell
friend.
says Dr. Ware is so knowledgeable and humble. Definitely one of my colleagues that I try to keep in my back pocket.
Yeah, we help each other out a lot. We truly
Yeah,
do. I really
awesome.
appreciate her having her around.
Yeah, great people. And ladies and gentlemen, if you missed that episode last year, we had a fantastic episode with Dr. Snell, and she gave us some great pointers and tidbits on oral health as well. All right, let's see. Roderick, Rod Reed. All right, my
Rod
brother.
Reed, my brother.
Yeah. She said, why? He says, why are wisdom teeth so problematic for people?
Okay, so I mean, that's not a hard question. So most people don't have space for the wisdom teeth. So the wisdom teeth are basically the third molars. You have the molars are the back teeth, right? The bigger ones that are made for crushing. And so you have three of them. You got two that's usually in there by the time you're 14, 12, 14. The third one usually comes in around 15, 16, 17. Some people's mouths are large enough to accommodate those third molars. Some people's mouths are not large enough to accommodate them. And then sometimes they will come in like sideways. Sometimes they'll come in like kind of weird. And so we generally like to go ahead and if there are potential for a problem later on, we like to go ahead and get them out. Um, just because the older you get, one, harder your bone gets, and then secondarily, the less you heal, like the older you get. So we like to go ahead and take care of that, get those teeth out of there if they're going to cause a problem later on. They don't generally just have to come out just because they're the third molar. It's just if they have cavities in them or if they're not coming in the right place, we go ahead and want to go ahead and get them out.
All right. Dexter says, what natural ways or habits support strong gums and teeth?
Man, that's a great question. So most people have cavities because of sugar. All right. If we can just alleviate the sugar, then we'll have a better oral health situation. So I always say that I tell my patients that you need three things to form a cavity. You need sugar, bacteria, and teeth. So you're gonna have to remove one of those if you're gonna get rid of those get rid of the cavities. So what I would recommend is basically regular brushing and flossing. So I recommend flossing at least once a day. I like to tell people to do it before they go to bed at night, brushing at least a day, and that means 2 minutes. I usually recommend doing each quadrant for 30 seconds. So this is a quadrant one, two, three, four. Do each quadrant 30 seconds to make sure you don't miss anything. I usually recommend flossing before you brush. I like to say floss before you brush to kind of knock everything loose that's in between your teeth. Most of the bacteria in your mouth is going to be hiding in between your teeth or on your tongue. So you want to take that floss and go in there and clean in there really well. Brush really, really well if you can. and then use a mouthwash. That'll get rid of the bacteria. So most of the time, the cavities are going to be, especially with people that have rampant cavities, going to be caused by sipping drinks like anybody
Mm,
that drinks like Coca-Cola, Dr. Pepper, Mountain Dew, people that drink that kind of stuff are going to always have rampant caries. Caries means cavities. So
mm,
that's because they tend to sip on the drink for a long period of time. The
mm.
problem with that is
Okay.
that the bacteria in your mouth, every time you have sugar in your mouth, then that sugar is going to be digested into acid, and the acid is going to sit on your teeth and dissolve your teeth. So the longer you do that, the worse the teeth are going to be on. So if you're going to have those drinks, just go ahead and drink it and get it over with. And the constant sipping, the slow sipping is going to be a problem. And most people don't floss, so you gotta get that flossing in, or you're gonna miss the majority of what's going on.
Wow. Man, that's even personally, man, that flossing thing, because it's like I feel like, especially the way, and what's interesting is whenever you get a cleaning, and the dentist will come in after the hygienist, and they, y'all wrap that, floss so quickly, and I noticed that you guys don't use floss pick, you guys use just straight up good old fashioned Oral B floss. I always saw that.
Yeah, I don't like the flower sticks. Now, I try not to speak against them because people use them. Some flossing is better than no flossing, so people tend to use the floss stick more than they do the regular floss. So I don't speak against it. But if I had to choose whether I wanted someone to use the stick versus the regular floss, I would choose the regular floss. Just because sometimes that regular floss, when they'll just push it down. So you take it and push it down in there, and then the bacteria that's between your teeth, you just push it down under your gums. So what you want to be doing with the floss is actually moving it and then pulling it up. So you're trying to pull everything up so you can brush it out and then rinse it out.
Awesome. So basically, you're saying floss before you brush. Then do they floss, brush, mouthwash, or floss, mouthwash, and then brush?
Mm-mm. Floss, brush, then mouthwash.
All right, gotcha. All right, we're gonna keep on rolling here. Let's see. To
Yeah, we got a
Yasmin.
bunch of questions, man.
Yeah, man, I'm telling you, we are. And then I see one with my mom. My mom's got. So look, I'm gonna go ahead and. So every episode, we always get caught with this, and it's probably I use about the first 10 minutes for our intro. Well, actually, before that. But anyway, every time we do Telehealth Tuesday, right at the end, we get a surge of questions. But man, this one, everybody's been engaged basically, the entire episode. And so I always ask the guests, hey, would you mind staying with us an extra 10 to 12 minutes? So, Doc,
Your
would you?
phone is ringing, man. Your
Yeah,
phone is ringing, man.
hey, look, I'm going to put that
Somebody's
on the side.
calling the doctor right now.
Hey, it's after 5, man. um, do you have an extra 10 to
Man, I'm
12,
good.
13 minutes?
I'm at home, man. I don't have anywhere to
Okay.
be.
All right. Awesome. Awesome. All right. So let's go to Yasmin. Were there times when you did not know what to do and unprepared for the problem? Oh,
That is a
interesting.
fantastic question. So,
Yeah.
the thing about dentistry is just like medicine or any other thing in life. So people come with very complex problems. Sometimes you know the answer, sometimes you don't know the answer. So most of the times, just like Dr. Bookhardt can speak to that. So when somebody
Mhm.
comes in with a problem, you have what you call a differential diagnosis, where there is several different things that could be causing this problem. So what I generally do is I kind of rule out what I know it's not, and then out of the couple of things that I think it is, we'll treat one thing or either refer out. So we have specialists that we have in the area. Thank God for specialists that they do specialized things. So I always because you always want to engage other doctors when you're trying to do the best work for your patients. So as much as you like to keep everything in house, the patient is most important thing. Most important, the patient's health is the most important thing that's going on there. So I always, if it's something that I'm not sure about, I will refer out. I have specialists that are endodontists, which specialists that do root canals. I have oral surgeons that We'll do biopsies. If it's something that I'm seeing that you can't tell what it is on the X-ray, I do what's supposed to be done. I send them to get a biopsy, and then they send it off to pathologists. The pathologists then tell us what it is, and then we'll go by treatment that way. So it's, I guess that is knowing what to do or refer out. So sometimes you're not really quite sure what's going on, but you want to do what's best for the patient at all times.
Absolutely. Absolutely. And, I'm just going to jump in just for 30 seconds to say, Yasmin and anyone else who, was wondering that type of a question, I second my brother here because, like you said, in whatever field of medicine you're in, I always tell when I have medical students and or resident doctors, I always tell them, what is a dangerous person? That is a person who feels that, like you said, they want to keep everything in house. They feel like they know everything, and even at the risk of the patient, because they don't want to either look, ignorant, or they don't want to look bad in front of their colleagues. They will keep, trying to do things that they know are frankly above their pay grade, and the patient is the one suffering. And so that's a dangerous person. So, like you said, Doc, that actually that is knowing what to do, because when you realize, hey, this is getting a little bit in the weeds here, I better kind of farm this one out. So, absolutely. All right. My mother, hey, Terrance, I told you when I said my mom with Black Dennis, here she is. She's got a long one for you. Um,
Uh-huh.
but thank you so much for joining, Mom. So my
Hey,
mother, Lily,
mom.
she says, and she's got quite a story with the plan she has. She has some fantastic. You know what? By the way, before I read it, have you ever heard of? Man, his name just escaped me. Doctor. This guy was studied by Dennis World. Doctor Tatum. Had you ever heard of Doctor Tatum in
No, I
Florida?
don't know. No, I don't know
Okay.
about the time.
All right. He had a certain way of putting these special implants, and she had some that he did, I think, 30, 40 years ago, these blade implants or something like that. But
Hmm.
anyway, she says, and implants are better if you can afford. Okay, she was piggybacking on that question.
Hmm.
Implants are better if you can afford them. I have implants that I have had since 1980, but I've spent more than $79,000 on implants. So it is important to brush and floss your teeth to save your natural teeth. I used to eat hard candy without brushing my teeth afterwards.
Hey, man, that she got her money worth from 1980. That's the year I was born.
Yeah, right.
That's awesome.
Yeah, it's amazing. Let's go to Yakisha says those big veneers scare me because I have small teeth, and I want them on the bottom.
A lot of people go like out of the
Big,
country and do it. They'll go to like Atlanta or different places to people that's not really dentists, and they'll have them do it. So that happens a lot.
oh yeah, yeah. Dr. Turner
Yeah,
said
that happens a lot.
more than just dentists putting those in. I got you.
Right.
Yeah. All right. Let's see, Rod. Let's go back to our brother. Rod says, why is it that people have lots of problems out of wisdom teeth that have to be removed as compared to other teeth?
Oh yeah, we answered that one already. It's just because people don't have room for them, and a lot of times they're so far back there, people don't really brush them as well as they can the other teeth, just because they're so far back there. And then the anatomy is a little bit different on wisdom teeth, so they tend to have more problems there.
Absolutely. Dexter saying, let's. I see my line brother there. But before you go to Dexter, Cordell, the good brothers. Hey,
Brother Cordell, gotta get
man.
together soon, man.
Yeah, man. Thank you for joining us. Thank you for. I was gonna say, Cordell. Wait a minute. They let you in here, man. I need to talk to the software. Nah, I'm just. Man, he gives me a hard time, man.
You know it.
He gives me a hard time, man. But we love him, man. All right, Dexter. He says, isn't infections in the mouth is okay? You're saying infections in the mouth is highly associated with a unhealthy amount of inflammation in the body. Oh, okay. You're saying two questions. Isn't infection in the mouth highly associated with a high unhealthy amount of inflammation? And then two, what would you say, things like ginger, turmeric, lemon balm, and other herbs would be the way to reduce this inflammation, which would reduce mouth infections?
Yeah, I mean, whatever works to reduce the inflammation. So generally, um, inflammation is usually a reaction to something that's there that's not supposed to be there. So just like steroids or other things can reduce inflammation, but they don't remove the impetus for the inflammation, if that makes sense. So a lot of times the impetus for the inflammation is the bacteria that's in your mouth. If we're talking about dentistry per se, so so just like if you have a viral infection and you get sick, the inflammation that you have in your body is based on the virus, and so your body has to kill the virus in order to get rid of inflammation or inflammatory responses in your body. Uh, what the meds that you take are really to reduce the inflammatory responses, which kind of does two things. It sometimes it'll hurt the problem, right? So the inflammation that's there is bringing in the white blood cells that you need to actually fix the problem. So and so just like if you have a cold or anything like that, you need those white blood cells to kill the viruses or kill whatever's going on in your body. But you want to also not be so sick. Inflammatory response really makes you feel sick. So yes and no. So you need those things to help you reduce the inflammatory responses in your body, but you want to also address the impetus for the inflammatory response, if that makes sense.
Yeah, absolutely. We got a couple more before we end for the evening. I'm gonna go ahead and scroll down here to our most recent question because she is the queen of your household,
Sister Will.
attorney attorney Andrea King Ware. Uh, she says, "Can you talk about the importance of wearing a night guard if you grind your teeth at night, and how can you tell if a patient actually grinds at night?"
That is an excellent question. So, so grinding your teeth, it causes several different problems. So, the first problem with grinding your teeth is it can cause pain in your joints, which will in turn cause headaches. It can also start to have pain down your neck and your shoulders from grinding. Okay. Um, Also, if you grind for a long time, over a long period of time, you start to kind of wear away your teeth. I don't know if you ever seen people that kind of their teeth look straight across where they've been grinding so much. And what'll happen is you'll grind down so much, what they call the VDO, which means the vertical dimension of occlusion, where their mouth kind of closes in, where it used to be kind of open a little bit when it closed and it closes in. The problem with them when you need to fix the teeth, you have to fix all the teeth or take the teeth out to fix them. Okay. Um, third thing is that sometimes it's gonna be when people have when people are grinding like this, it can be also connected to other different stuff like sleep apnea and all that kind of stuff. So so it's very important for people to wear their night guards to keep from causing a lot of those problems. Also, a lot of people have. Speaking of sleep apnea, a lot of people have sleep apnea, and that's because of the closing of the airways. Now, the dentists,
Mhm,
we do make some people will wear the CPAP machine, which basically force air down into your body. Dentists also treat sleep apnea by pulling the jaw forward, the lower jaw forward. So there's a mouth guard that you wear that pulls the lower jaw forward. So just like when somebody when they teach CPR classes, they say the first thing you want to do is make sure the airway is open. They have you lay down and you kind of lay the patient back and open up the airway.
mhm.
The night we have a night guard that kind of does the same thing that works a lot better than forcing the air down in there.
Excellent, excellent.
That's a great question, Sister Well.
I thought you'd agree with that too, man. That's great. All right, so we've got brother Frank Terry on Instagram has got a question. We've got a couple more, and I see Keisha got. So look, I know we're over time, so we're gonna take one more question. I see your Keisha's is the last one that I see. One more question on the Facebook and YouTube end. All right, let's go back to Ellen. Ellen says. please tell when braces are put on children, basically about what age can braces be put on children?
That's a fantastic question. Um,
Mm.
so all right, so I give long answers, but I like for people to understand what my thought process. So there is a part in a child's life when they have what's called mixed dentition, which means they have some baby teeth, some adult teeth. Okay. Generally, when they have the some adult teeth, some baby teeth, and their head is the size of a baby, the teeth that their adult teeth come in as the size of adult teeth. Because of that, they're going to have
Lord.
crowding. It's going to be crowded, okay? Because they have some baby teeth coming in, some adult teeth in. So I generally don't like to put patients in braces until they get at least most of their permanent teeth in. The reason why is because the jaw is still growing and those teeth are not in. So what generally happens now, this is my own I have my own anecdotal knowledge from this where I've seen this. I have not seen the studies on this, but this is what I've seen with my eyes. So generally what happens when a child is young, 6, 5, 6, 7, 8 years, somewhere up in there, 7, 6, 7 years old, what'll happen is the child will start losing their baby teeth and start getting their adult teeth in. And usually the mama kind of goes crazy, like, my baby's teeth are coming everywhere. You need to go put some baby teeth back. So they end up putting the braces on the teeth early, right? And so by the time the baby teeth come out and the rest of the permanent teeth come out, actually come in, they have to wear the braces much longer, right? When they could have
Mm,
just waited until to the jaw grew, and then into the permanent teeth came in, they could have worn the braces a lot shorter time. So
mm,
that's a long answer for saying I want to wait until those permanent teeth come in, basically. Now there are some instances where I would want them to go into braces early. Sometimes patients will have problems with they'll have a skeletal defect where basically they have maybe like class 1 or class 2 or class 3 skeletal defect, which means that their lower jaw might be either way protruded or way behind where it's supposed to be. And sometimes I would like to intervene a little early to take advantage of the growth spurts that patient is going to have. And so that way you don't have to break stuff later. So once the bones grow in place, I don't know if you guys have ever seen somebody, the lower jaw is like forward like this.
hmm
Sometimes they have to break the jaw and move it back in place. Now, sometimes when you catch that early and put that patient in a what they call an orthodontic appliance, where it's like a
mm,
headgear or some type of appliance to take advantage of the growth spurt, then everything can grow in place at the same time. Or if that patient has a really high palate, which means like the teeth on the bottom are inside of the teeth on the top. So sometimes you can put
mm,
an appliance in there to kind of push the jaw open a little bit wider. They do that. It's called a rapid palatal expander, which kind of expands the palate before that suture kind of there's a mid palatal suture in the middle. As they get older, it calcifies. So if you get it while it's young, it works out. So that's a long answer to say I like to wait to the permanent teeth are in, uh, unless there are other circumstances.
mm. Gotcha.
I know that ain't
Excellent.
bad.
Excellent.
Just
Excellent.
my son.
Yeah. All
That's gotta be
right.
my son.
Your son. Let's see.
Don't ask that.
Don't, how did? Oh, oh Lord.
That's gotta be my son.
Yeah, oh, no, that's not Yasmin. You
No,
talking about that question?
absolutely
Yeah. Um. Oh. Let's see. You guys. Okay. This is you guys are great to watch. Both knowledgeable with a great sense of humor. I love it. Black genius. Thank you. Thank you so
not.
much
She's
for your
talking about you,
support.
man. She's talking about you.
I mean, look, she never made that comment until I got Terrance Ware on him, man. But
Uh,
she's always supporting us. Been here essentially from day one. So we thank you for your support so
Thank you so
much.
much, Ms. Bacon.
Yeah. Um. Yeah, well, I'll leave the how deep is your. I'll leave that one. Yeah, I'll leave that one.
Womp, womp,
Uh,
womp.
let's see. Okay, and I said Frank. I told Frank we come back. So I think Frank's going to get the last question. It's 8:16. Frank's going to get the last question of the evening. And Brother Frank Terry says, "What are some alternatives to a traditional toothbrush?"
There are no alternatives to a toothbrush. So there are regular toothbrushes. I mean, I like electric toothbrushes that work really well. I like the Oral-B IOs. That's the one I use. Um, but a regular toothbrush gets the job done. But if you're trying to go outside of the toothbrush, I would not recommend that. So a regular toothbrush, you can be a dollar toothbrush, or you can get one of the good ones like one of the electric toothbrushes that work really well. Just regular floss, regular toothbrush, regular toothpaste, and you can make something really happen with that.
Excellent. Well, look, I know we went over, guys. I know we went over, and thank you all for, man, thank you all so much for hanging with us. Um, you guys are amazing. You've been supporting us for 49. You know what? I want to say, give the audience, give yourself a round of applause, man. 49 episodes. 49 episodes. So thank you so much. We'll do something special next week for 50. So, Dr. Terrance Ware, we first of all, thank you so much, my brother, for joining us. I know it wasn't easy to get you here with us, but you've been here, and so I know that you'll join us again. I know we'll do it again. So, oh man, okay, I was looking for something after that,
I won't
but
say
look,
anything. I won't
okay,
say
all
yes. I
right.
won't say no.
All right. Well, look, I'd love for you to quickly tell the audience, for anybody who did not hear initially, where you told everybody about yourself, where you're located. Would you please tell our audience where you're located, how they can contact you, uh, and whether or not you're taking new patients, and anything else you want to provide.
Okay. Well, thanks again, brother Bookhardt, for inviting me on. Even though it's like pulling teeth, getting me here.
That's
I
all
generally
good.
don't like talking in public. I like to talk, but I don't usually generally talk in public. But anyway, I we have a practice right in Jackson, Ridgewood Road in Atkins, and practice there in Flowwood, right on Keywood Circle. It's right in the area between Flowwood Drive and Airport Road there in Flowwood. Um, we have a great staff. I think we have a great staff, two great hygienists that come in and do a great job with patients. We try to be informative. We try to be formal when we need to, when we play, kick it a little bit when we need to. Um, I want to make sure that my patients are receiving the best of health care. We try to do the best we can to give you everything you need in house as much as possible, and refer out when we don't do it. So I think this has been a great time tonight. I didn't
Man, awesome.
anticipate talking this long, but we've had
Yeah.
a fantastic time tonight. So I thank you again for inviting us on, and we look forward to
Yes, sir.
having patients giving us a call. Our office's number is 769-251-5909. This is Dr. Terrance Ware, um, Ware Dental Associates, twaredds.com. Um, and I want to plug something else really quickly while I'm here.
All right.
Um, I know you're a physician. If any of you guys know someone that's dealing with Alzheimer's or any kind of mental um, things that they have going on, Alzheimer's, people that may be dealing with um, any kind of cognitive, problems, might be from stroke. I um I know some great neurosurgeons in New Orleans that have new treatments for that. So
Okay.
if I, I think the company is called, golly, I'll get you the company name. I can't remember, but
That
it's going to
sounds
be in New
Dr.
Orleans.
Marcus.
Marcus
Dr.
Ware.
Marcus.
So that'll be. I mean, it's a new thing and it's going really well. So if somebody knows about that,
Mm,
I had them reach out to you. You probably easier to find out. Reach out to me and we'll get the number. I cannot believe I forgot the name of the business.
mm.
But yeah, reach out and we'll get that to you. Okay.
Yeah, man. Excellent. Excellent. Well, we'll definitely do that. And well, thank you all so much. Again, thank you to Dr. Terrance Ware, all of our wonderful participants and audience. You've been amazing. Um, what is, yes, I, I don't know what she's talking about, Doc. I don't,
Man,
yeah,
that's
I
that's
don't,
my gotta be my son, man. It's
that's
no
your
way.
son there.
Gotta be.
Um, well, if you wouldn't mind, Doc, if you'll just hang on when I go off live, man,
Okay.
just if you'll hang on with me. So yeah, just one second.
Okay.
Um, so, all right, ladies and gentlemen, thank you for staying with us. Next week, we're going to have an amazing guest. You'll find out in just about 2 or 3 days.
That's the name
You'll
of the
find out.
company. I'm sorry. That's the name of the
Oh,
company.
okay. Single.
Singular.
Oh, okay.
Thank you, Yasmin. Singular is the name of the company.
Oh, okay.
Singular is thank you, sweetheart.
That's
Singular is the
funny.
name of the company. I'm sorry.
Let's put that up there. Oh man, this
I
is
was like, what
hilarious,
are
man.
you talking about?
We put it up there. All right. Next week, you'll find out we have amazing guests as we have blessed to have been here for 49 episodes. You don't want to miss episode number 50. And so just make sure to subscribe, share, tag, like Doctor B T.V, YouTube, and make sure to subscribe. Especially, you're going to see who we'll have. We're also streaming live to LinkedIn, Instagram, and also Facebook. With that said, we hope you'll join us. Make sure to bring a friend. If there's anybody you want us to see, feel free to reach out to us or email us, DM. If you want to be featured on the program yourself or your business, we're happy to have you on there. If you want to see Dr. Terrance Ware again, by all means, let us know. God willing, we'll see you next Tuesday at 7 p.m. And as always, remember that true wealth begins with good health.